The type 2 diabetes is a very old medical condition, but in the second half of 20th century, it grew massively, affecting millions of people around the world. So it has become a major health problem for many countries, including the United Kingdom. So more concerningly, it has started affecting people at a very young age. But fortunately, so there has been a lot of research that has gone into understanding type 2 diabetes and its management. More importantly, so these medications not only improve the glucose control, but they also bring a positive improvement in the complications or reduce the risk of complications, particularly that affects their kidneys and the heart of the individual. So as a result, they reduce the morbidity, that's the amount of time an individual has to live with complications or getting admitted to hospitals, and to reduce the mortality. In other words, improving their lifespan, particularly the healthy lifespan. So what has also happened in the last 50 years is increase in the rate of obesity or increased weight in individuals. So it could have multiple factors, so mainly urbanization, availability of high-calorie food at a relatively low price, and the busy life schedule of an urban life commitment, which reduces the amount available for exercise and improved quality, and the stress that of modern life also adds to this. So this has contributed in a major way to increased type 2 diabetes risk. So there are certain medications which effectively control type 2 diabetes, as well as help in reducing substantial amounts of weight. So there are two particular groups of interest here. The first one is called SGLT2 inhibitors, so which work on our kidneys by increasing the amount of glucose lost in the kidneys, which as a result improves the glucose level, but also reduces the risk to kidneys as well as to the heart. So much so that it has become these group of medicines have become medicines that can be used in people who have got primary heart conditions. Secondly, there's another group of medicine which has been used since the 2007-8 for managing type 2 diabetes. So they are called GLP-1 analogs, which is a type of gut hormone. So when given as injection, reduces the glucose values, but it also has an effect on satiety, reducing hunger, and as a result, it helps people to lose weight. In the last decade, these medicines have been approved for use as a weight loss medication in people who have got difficulty in managing their weight due to various reasons. As a result, these medicines not only reduce the weight, but they also reduce the risk of people developing type 2 diabetes, so particularly people who have got pre-diabetes, and also people who are at significant risk for heart disease, who already had a heart disease or got a strong risk due to high blood pressure or high cholesterol values, which are common associated complications due to obesity. And obesity is also related with the psychosocial aspects. So this is affecting their mental health, their social health, their psychological health, and these medications which effectively reduce weight, as well as the risk for type 2 diabetes in people who do not have it, and improve the control of type 2 diabetes in people who already have it, in bringing in an overall improvement in their physical, emotional, and psychological health, while reducing their long-term cardiovascular risk. When I say cardiovascular, it is a risk of heart attack and stroke, as well as reduced circulation to their legs. Additionally, obesity is being now recognized as a chronic disease in itself, rather than a risk for other diseases. As a result, the approach to managing obesity has moved away from temporary interventions to interventions that are sustainable and long term. So this is where these medications, which are effective against type 2 diabetes as well as obesity, while reducing the risk of heart attack and stroke, becomes very important. Having said that, so I must emphasize that the primary interventions for managing both type 2 diabetes and obesity is focusing on lifestyle, that is, reducing the overall daily calorie intake and increasing the calorie consumption by doing more exercise, at least 30 to 45 minutes per day of moderate or high intensity cardiometabolic exercise. So when people with type 2 diabetes, they either through increase the physical activity or reduce calorie intake, and they reduce weight as a result of the reduced carbohydrate load or burden. So it naturally improves their glucose levels. So it makes the medication that they're already taking more effective, or it results in them taking fewer medications to achieve a better control in their diabetes. And it is more important that people start this journey even before they develop type 2 diabetes, when they're at a pre-diabetes stage, or when they identify a risk for developing diabetes, which could be if they belong to a certain ethnic background like South Asians, if they are overweight, so which means they have a body mass index of more than 27, or their waist to height ratio is more than 0.5, or they have a strong family history of type 2 diabetes. And weight loss also increases the insulin sensitivity. That means whatever insulin is available in their body works better as a result. So it helps the body to regulate glucose values much better, and then reduces the glucose levels and improves the diabetes control for those who already have got diabetes. There are two groups of medicines which are very effective. So the first set is tablets, in which there are three. The one is metformin, which is being used for many years, which increases insulin sensitivity. It improves the diabetes control, but less effective as for weight management, but it doesn't make people gain weight. The second group is SGLT2 inhibitors, which act on the kidneys by increasing the glucose loss in the urine. As a result, it regulates the glucose system within the body. It improves the diabetes control, as well as it protects kidneys and heart in the longer term. The third group of medicines are called GLP-1 analogs, which are available both as tablets and injections. They improve diabetes control, but they also regulate hunger by reducing hunger, and they increase satiety as a result of all of it. So they improve diabetes control as well as help to lose weight. So of the three groups of medicine I mentioned, so SGLT2 inhibitors and GLP-1s are more effective in weight management, particularly the GLP-1 analogs, which are commonly available as semaglutide, dulaglutide, or tirzepatide. They are available in different commercial names. So these injections are typically taken once weekly, and the earlier versions had to be taken once daily, but the current versions are mostly once weekly. They, in addition to improving diabetes control, they're also very effective in reducing the risk of heart attack and stroke in people who have type 2 diabetes and obesity, or obesity low. But it is important that all these medications will not work for everyone, and there are certain limitations and contraindications as well. So it is extremely important that this information, whenever you are starting those medications, they are started on the advice of a qualified healthcare professional who has an expertise in this field, and also to recognize any side effects early. Particularly with these weekly injections, it can result in inflammation in the pancreas very rarely. If someone who is taking these medicines, if they start developing pain abdomen or tummy pain, which is not going away, or nausea or vomiting or being sick, so they should stop the medication and then consult their healthcare professional for further advice. So these newer GLP-1 analogs, which are usually taken as injections once every week, which are licensed both for managing type 2 diabetes as well as managing weight, particularly aimed at weight loss. So they are much more effective than any other groups of medicines for weight management. So they are recommended at a slightly higher dose for weight management compared to management for type 2 diabetes. So in the studies that have been conducted and published, people have lost anywhere between 10 to 15% of weight, and in some cases up to 20% of their body weight. But it is important that in practical experience, for people to understand, so that when people lose weight, they could lose both fat and muscle, that they incorporate regular exercise, particularly resistance exercises, so to build a muscle, so that there isn't a relatively more muscle mass loss, so that can lead to other consequences. And for that reason, it is again important that so you're in contact with your healthcare professional for ongoing advice and guidance. So in managing these medications, particularly when using for weight loss. So lifestyle changes are paramount in managing both types of diabetes and weight management in people as a prevention strategy, even before developing type 2 diabetes, and as an adjunct strategy for along with other medications so they're using for this. So it could be reducing the amount of carbohydrates or overall calorie in their day-to-day meal, or using any of the proven strategies. It could be a low carbohydrate diet, which should be done under supervision, and regular exercise. So exercise at least 30 to 45 minutes of moderate to high intensity, so done at least 4 to 5 days a week. So these strategies would certainly help when followed on a longer term